Okay, so good evening, everyone. As we all have seen the poster, our today's speaker is Devika. She has been working with as a consultant for 4 years, and past 2.5 years she has been associated with a mental wellness company as a senior psychologist. She holds a BA with psychology majors, and she has a tremendous experience with sessions and everything. So, without getting delay, over to you, Devika. You can just start the session.
Thank you so much, Navneet, for a wonderful introduction.
Short but
and
sweet, right?
yeah, it was, it was.
Yeah.
Hello and namaste to everyone joining here. And I'm really happy to see that, and such a huge platform. We are talking about mental health. We are talking about mind. We are talking about mind management. Okay. Just one small correction as Shravani was introducing me. Many people, especially here in India, do not know the difference between a counselor, a psychologist, psychiatrist. There is a spectrum of mental health professionals. So I have indeed done my BA in psychology, but to practice, we require an MA, a PG in clinical psychology. Okay? So just to add that a bit. Okay? Yeah. So today we are going to talk about mind management. And when I say we are going to talk, I really want your insights, your inputs, because mind and the topic we are going to discuss today is related to all humans, right? And we all are humans here. So I would really appreciate questions as well as your inputs regarding the experiences, anything that you might resonate with or not resonate. Yeah, I would really like to share that. Now, since the name of our topic today is mind management, and we are saying let's manage the mind before the mind manages us, let's understand the structure of the mind a little. Okay? Let's understand the nature of the mind. Uh, an interesting question for everybody, and for this, I really wish if you switch on your cameras, I would really like that. The question is, where do you think the mind is located? Everybody has a mind. So, can everyone show where the mind is located? Please do not Google because the answers of Googles are different. Yeah, Prince is saying here. Okay. What about others?
Not sure, but it's like near some heart or somewhere, if I'm not wrong. I don't
Huh?
know.
When we say all is well, that's
Yeah,
that's
we
how
say
it
always
is.
well.
Okay, here and here. Anything else? Anybody knows about the mind? कहीं पे सुना है, देखा है, anything like that? Anybody has heard of?
Guys, you can also type in a chat box if you are unable to switch on
Yes,
your cameras. That's fine with us.
definitely. Yeah, because everybody talks about mind, no? My mind has been depressed. My mood is low. My mind is not well. मेरा मन नहीं कर रहा. That kind of things we say on
Maybe
daily
it's
basis.
forehead, I guess. Right?
Here,
Yeah, forehead.
okay,
Yeah.
okay, yeah, I can consider that. Yes. Okay. Anybody else want to add to the organ of the mind? All right. Now, if you Google search it, it will come as brain. Okay? So Prince was sort of right. So here. But when we talk about managing the mind and managing our reactions, when we say mind, there are so many things associated with it. Right? The mood, like I said, the depressed sort of a feeling, so an emotion, a thought, so many things. So when we practically say mind, we talk about mind or healing of the mind. Mind does not have a specific organ in terms of healing and treatment. Okay? Mind, the entire body is the organ of the mind. I always say that because uh, emotions coming from different sort of experiences we have as a human are stored in different parts of the body. Many people, many clients come to me and say, I have a lot of backache, बहुत ज़्यादा पीठ दर्द है, and there are a lot of scans and everything happening, a lot of blood tests and all, and the doctors are unable to answer me. They knock on different, doors and search for different sort of doctors there, but they do not find the real answer. And finally, one doctor tells them, okay, this is according to stress, something is wrong with the mind, and you need to consult a psychologist for that. Okay? Now, many of the times, such patients have a history of trauma or some unhealed traumatic situations, some unhealed emotions, which get stored in the back. Okay? If you are, for example, suffering through a lot of pressure, some stressful situation, usually have a jaw pain. You keep visiting dentists, you keep visiting orthodontics, and nothing happens because these emotions are suppressed and stored in the jaw part of your body. Okay? Similarly, you might have seen people with a lot of anxiety always having bowel movement issues or always having acidity issues, gastrointestinal issues, endocrine issues, all of that. So, what I meant to say is that the entire body is the organ of the mind. So, if we want to excel in different domains of our life, we need to take care of our body, yes, and along with that, we need to take care of our mind as well because the thoughts and emotions are stored in it. Okay? Brain is a very logical area which we are talking about. Prince was right. So brain is a very logical area that we are going to talk about later. But this was about the mind. Now, as I said, let's understand the structure of the mind. Mind has three parts to it. Okay? I think everybody here must have heard about it. Unconscious mind, conscious mind, and the subconscious. Okay? Unconscious mind has a lot of theories associated to it, but most of it is not explored. So there are still studies and everything going on. Psychology is an evolving science, so it's still being studied upon. But conscious and subconscious mind have been discovered, and there are a lot of theories and a lot of study material to take a look at when it comes to them. Now, conscious mind and subconscious mind are correlated. Simply, we take the information, the conscious mind takes the information and gives to the subconscious mind. This is the experience. Please process it, boss. You need to, categorize it and tell this human how he feels about it and all of that. Okay? So all our experiences, whatever we go through, are processed by our subconscious. So today, as we talk about our mind, we are going to talk about the subconscious mind more than any other parts of your. So that was the structure of the mind as such. So if anybody has any questions, you can go ahead.
Devika, I have a question. You
Yes.
mentioned that there are three parts, right? Subconscious, conscious, and another one. So, is there any particular criteria to differentiate between these three? Like, how can we
Yes.
differentiate? Like, this is the thought which is coming into my mind that is due to the subconscious mind or subconscious mind. Like, that can we differentiate something?
Yeah, definitely. So, as any other parts of your body and your the functionality uh, can help us. I'm so sorry. The functionality of these minds, we can use it for differing, okay, for categorizing. Now, like I said, unconscious mind has not been discovered yet. So mostly some dreams or some unexplained behavior can come from the unconscious mind. But we haven't shed a lot of light on that, in researches and all. But the subconscious mind and the conscious mind, as I said, are like correlated. And conscious mind has the function. The function of the conscious mind is to grab information from all the senses. Okay? So all the senses, all five senses are working and reporting to the conscious mind. All the information we collect from these experiences are then sent to the subconscious mind. Subconscious mind is the backstage of you. It processes all these informations for you. Whether from this information, a simple example I'll give. If you're stuck in traffic, you easily start feeling agitated and you are irritated. Then there are a few words that start coming up to your mouth, and you start yelling at people, and all of that happens. So that is stored and processed by the subconscious mind. The triggers are caught by the conscious mind. Okay, I have to reach home. That's not happening on time. There is a lot of traffic. It is making me uncomfortable. This is the information sent to the subconscious mind. Subconscious mind categorizes into good, bad experience. It processes the past experiences as well. Okay, पहले भी ऐसे हुआ था. This has happened before, and that time this person was furious. Now it's the time for us to send that emotion. If anybody here has watched Inside Out, they might relate to this, right? So the information which has been processed in the past is used as an evidence. Okay, this is how this human reacts, and then the reaction is produced by that. So I hope I answered your question, Shavni.
Yes, yes. Thank you so much.
One. Anybody, anything else about the uh, any sort of any part of the mind? Anything related to your personal lives, which you related to?
No, it's not a question. So generally, I keep hearing it's all about mind. So everything is depends on mind. So what you are is mind. So like, how do you tune and how do we control? Like,
Huh? Right.
those I would like to know.
Control. Okay. All right. Very, very interesting topic. My favorite topic to talk about. Great. Thanks for your question, Santosh. So, when we say mind control, okay, entire reason why the heading is mind management today and not control, I'll explain. Okay. Many a times, we usually say this. Many clients of mine come to me and ask me, I want to control my thoughts. I want to stop overthinking. I want to stop these negative thoughts. Okay? For this or any type of emotion also, many of our decisions sometimes are emotionally driven, and we end up regretting many. You know? Then comes in this mind control part. How to control your mind about. So we divide our this answer into three parts: thoughts, emotions, and behavior. Okay? Now, when we talk about managing the thought, first of all, I'm replacing that control with a little manage. Mostly because when we say control, we are trying to associate it with a lot of compulsive. We are pushing ourselves for something. Maybe we do not resonate with, or maybe we are not comfortable. So, control is something we want to replace with manage. When we say management, it gives you more authority, it gives you the feeling of leadership, it gives you the feeling of what we can say, something which is you are entitled to basically.
Like suppression.
Okay? That yeah, suppression. That happens a lot. So when we talk about managing these thoughts, it's very important to understand the nature of these thoughts are free flowing in nature. Something happens, all our senses are working all the time. They are grabbing information from everywhere. When you see even a color, right now I'm seeing all the blue, backgrounds for all your cells, and my mind is like, oh, blue is my favorite color. Nice thing to see. These kind of thoughts. They just start coming in. Similarly, negative thoughts also happen. So when you see something related to your negative experience, easily it is triggered. Any negative thought is triggered. Okay? If you see a swing and maybe as a child you had fell off a swing, you will easily get scared. That thought of no no no, I don't like swing. That will come. Swings hone ही नहीं चाहिए garden. They shouldn't be in the garden. That kind of we reach that level. So when these sort of thoughts come, we cannot practically stop them. But what you do about these thoughts is something that we can definitely work. Okay? When we have such kind of thoughts, especially negative thoughts are something that we need to work on when we say control or manage. Okay? It's very important for us to put a structure to these thoughts. When we say structuring the thoughts, it's nothing about categorizing or compartmentalizing because that the brain does not understand. But if there are any emotions associated with the thoughts, we have to separately deal with them. But just the thoughts are something what we need to be dealing with acceptance. Okay? When there is a thought about the swing, let's say, first I need to accept what my past experience was and how I'm feeling in the current. So we are shedding light on the association part. Management becomes very easy when acceptance comes. If you are in denial, yeah, I can easily go for the swings. Swings is not a problem for me. Your fear starts increasing because your subconscious mind is not ready for that. It knows the past experiences. It will say, no, you are afraid of the swings. This cannot happen. It will start increasing your anxiety. So first acceptance, and then taking this thought to a changing pattern. You need to bring about a transformation in the, I won't say change because change is a very small word, change the, we change clothes also every day. So let's say transform. We need to transform this thought to a better one, which is going to be a stepping stone. So structuring, putting a structure to these thoughts is something what we can do. Controlling is not enough. That was about one aspect, the thought aspect, the cognition part. Coming to the emotions part. Usually, human mind works in four domains: logic, thought, emotion, and feeling. Logic, thought, together we can club together. Emotion and feeling we can club together. Now, when we talk about again controlling the emotion, like Santosh suggested, we usually suppress it. We cannot control. That's not possible. So we usually go ahead and suppress. My clients come and tell me, I was sort of feeling, I wanted to cry, but I just distracted myself. I started watching my favorite. Okay? You can suppress once, twice, thrice. The fourth time, in an unusual situation, unexpectedly, you are going to burst out any which way. Okay? So again, we do not want to suppress or control these emotions. We want to channelize these emotions. There are techniques to channelize the emotion because it's sort of, when we say channelizing the emotions, we are basically practically giving, imagine it as a pipeline, given to our subconscious. Okay, this person is feeling sad, cry it out, let it out, give yourself some time, back to normal. Suppression doesn't allow you to be normal, fit into the normal category. It doesn't let you function properly. Whereas sharing and channelizing your emotion does that. Okay? So I hope I sort of answered your question, Santosh. There are many aspects of this, and I can keep on going on and on. But yeah, that was the crux.
Yeah, in a high level structural thing is matters, and we
Yeah.
should not suppress our mind. It accepts. I mean, we should accept our thoughts.
Accept, channelize, and yeah. Anybody else?
Yes, in continuation with this question only, you mentioned
Uh-huh.
something about thoughts, emotions, right? So can you able to explain us the relationship between these thoughts, emotions, and the effect as a behavior change? Like that, can you explain us?
Definitely, yes. Uh, so when we say thoughts, emotions, and behavior, these are steps rather than being three parts. Okay? Most of the times, first there is a thought. Again, like I said, you see something. There is a, let's say, a stimulus, as we call it in research and experiment. There is a stimulus. You know, we feel the need to react to the stimulus only when it is passed through two channels: thoughts, emotions, and then comes the behavior. When you see something that triggers a thought first, what did you think about this? Okay? When there is a thought, it is either something related to the past experience you had, it's either a new information to your mind and your brain, it's either, the third part could be some emotion, directly triggering your emotion, something like that. So, with these three aspects, your thought, uh, there is a thought generated, fresh thought generated inside you. This thought later on goes for the emotion because just the thought cannot produce a reaction. So this thought requires some emotion. Oh, a red balloon. I like a red balloon. Now I need to be happy. Then the emotion is generated. Oh, I'm joyful. I saw a red balloon. Red is my favorite color and I love balloon. Then there is a reaction. When this exclamation, oh, I like the balloon. I want the balloon. So this is the relation between thoughts, emotion, and behavior. There is always a thought first. Supporting to that thought, we require an emotion, and with the combination of both, a behavior, a reaction is generated or an action.
Okay, thank you, Devika.
Any other question? Anybody else? You can put it in the comment box. I think somebody just posted something. Oh, no, I thought it
He just mentioned that he's going to turn off so
was.
his camera.
Okay.
Guys, if you have any queries and if you want to ask that in Marathi or Hindi, you can just ask that, and she can answer in English as well. So that is not an issue. So if you have any queries, please feel free to ask the question.
Yes.
One quick question. Sometimes our mind sends signals, right? So in order to decision making and all.
Mhm.
So if we choose to something else, but it is actually supposed to take opposite side, like so. For
Sorry, could you
example,
please repeat? Yeah,
yeah,
I
the
didn't get
question
it.
is sometimes we need to make decisions.
Decision.
So
Yeah.
we have only two choices.
Huh?
Just assume. So we take one choice, but is once we take it, we realize that it is quite opposite. Like so,
Right.
I see few people actually taking, I mean, working on the opposite of their mind, and they are going successful. I noticed in recent days. So like
Okay.
is like is it something like our mind is managing something our surroundings, and how is it generally? How does it work around?
Okay. Can you give me an example? I think you were about to share something.
Uh, for example, in career wise,
Huh?
so one of my senior, like he wanted to uh, pursue something in front of him, like there are a couple of options. So finally he shortlisted like two,
Okay.
and he took, so majority people actually, for example, suggested option A, but he took option B.
Huh?
But
Okay.
option B actually worked for him. He took it anyway.
Okay. Uh-huh.
Oh, but our decision, like there it is failed. Like these kind of scenarios I came across actually. So I asked him, like, why? So majority of the people they suggested to go for A, but you took it for B. And
Right.
now, how would you know that now it would become successful? I asked him like recent days. So I
Right.
just worked. Even I thought to take A, but I worked opposite to my mind direction.
Right. Understood.
It's generic
So,
example. They were just
yeah,
give
yeah.
like
No, I got you.
so,
In terms of career, it could be a little different because when it comes to career choices, we usually go with an aptitude and an interest. There's a difference between both. But I will explain that also if you want later. But when it comes to decision making, there are multiple options in front of us, let's say, and your mind is saying something, but we really feel confused about that. We go for feedbacks, we go wait for people's suggestion, we meet expertise in the field, maybe if it's something related to your life and your career as well again. But in general, when it comes to decision making, there are two things that we need to have within us as we make that decision. One is a high self-esteem, because when we are practically making a choice, we need to be ready to take up, be ready for the consequences of it. And when you are not sure about yourself, the resources you have, we do not know whether the decision is right. Okay? So higher level of self-esteem always will always be a motivating factor for you. Okay, you want it, go get it. That kind of thing. Secondly, like I said, the resources. So the knowledge for it. While you decide to jump in the water, you need to know, at least have an approximate in mind how deep the water would be. So that knowledge, the resources around that should be more than 50% on you when you are making a decision. Okay? And the third part is intrinsic validation. Okay? When you seek for validation, when you ask for people's opinion and their feedbacks, it's okay. That's some amount, let's say 20% that should add to your decision. But 80% should be your intrinsic validation. When you keep depending on other people to validate you, for other people to push you, you always have that association of motivation coming from extrinsic validation. Okay? And when that validation breaks for some reason, you try to skip or fail or something. But when the validation is intrinsic, the motivation is intrinsic, the self-esteem obviously is intrinsic, you have 101% chance to win at what you're doing. Maybe the pace is slower because that nobody can decide practically, before you jump into it. but that is something you can definitely reassure yourself with. So that was something regarding decision making, how we can practically think when we are deciding upon. And when it comes to specifically career, if anybody has a similar question, in career we do take in consideration two types: aptitude and interest. Aptitude mostly talks about the ability, for you to perform or have some skills, while interest talks about your practical interest in the field, your curiosity, your willingness to be in that. So a combination of both is always great, but either of you, with either of the choice you make, you can always develop the other one. Okay? So yeah, that was the answer to your question. I hope it
Okay.
helped you a little, Santosh.
Yeah.
Okay.
So self-esteem is important first, and we need to be ready for the consequences. And third, if it is inclination towards both of them, like we can proceed in terms of decision making, what career wise.
Definitely. The knowledge, the self-esteem, and intrinsic value.
What's the last one? Sorry, I missed it.
Intrinsic validation. You should
Intrinsic.
be
Okay.
able to reassure yourself that
Okay. Sure.
whatever you're doing,
Okay.
valid.
Validation. Yeah.
Yeah.
Thank you.
Great question.
Okay, so
Anybody else?
yes, I
Uh-huh.
have. So I just wanna know, like, sometime, not sometime, but yeah, on a regular basis, we used to make some decisions. So at what basis we can, at what parameter we can uh, articulate our decision, whether it is good or not, like the decision that we have made, is it good or not? Or let's say if I have taken one, major decision, like joining one particular organization or leaving one particular organization, since your tenure is completed, but the organization was good, but now the core team or the leader uh, uh, ship is now changing. So at this point of time, I wanted to switch or leave just because the leadership is not there, good as comparison to previous one, but the belongingness to that particular organization is so strong that is holding me back to that organization. But I had made a
Right.
decision to leave, but after some time I said, is there any chance to rejoin? And then I rejoined it, and now I kind of, stuck in the emotional stuff,
Right.
because the leadership skill is not good at such, and now I am cooked. So yeah, I just want to know how to make the right decisions.
Right, right. I think you have the answer in your own question. Okay. I just explained the decision making, the criteria for decision making that I am supposing you understood, right? The self esteem, the validation, and the knowledge part of it. You need to have these three before you make a decision. Okay? Especially when it is about career also and any step that you want to take for. Okay? Now, answering specifically to your question. Now, when you said that you wanted to leave for a particular reason, okay, this reason should be your priority at that time. Okay? For everyone, there are generalized techniques, there are generalized rules for everyone out there. If you search on Google, give me tips for weight loss. It's same for everyone. It's generalized topic, but we need to have customized, what we can say, plans for tailor made for your particular need. Similarly, as you keep evolving in life, with just pertaining to your example life, I'm saying, when you are evolving in life and you have a reason to switch from one job to another or to leave one particular place, you have that as your priority. And if you feel dicey while you leave or while you make this decision, you need to work on your priorities. When you say you have a particular reason to leave something or to join something, make sure that is your priority number. So this prioritizing will help you make any decision after going from the filter of self-esteem, validation, and knowledge. Actionable part when it comes to you need to prioritize.
But
Yeah. Uh-huh.
somewhere or other, like the past belongingness, somewhere invaded your priorities. So what's next then at that time?
When you say belongingness, are you referring to the comfort zone you have in your previous organization?
Not exactly the comfort, but the learning and experience that you had in that particular organization.
When we say prioritizing, okay, these learning and this experience, ask yourself, are you able to use it for your growth as you evolve? That's why I use the word evolving. When you evolve, you have to shift, you have to go through that transformation. It's not at all easy, but it is required for you to reach a certain level if again that is your priority. Okay? So that belongingness you can create in your new institution. Yeah. When we move ahead or let's say pass out from one organization, it does not mean a complete disconnect. You have a takeaway, right, from that particular organization. Yeah. It's about the mindset and training your mind about.
Got it, got it. Thank you. Thank you so much.
Devika, there is one question in chat
Yeah.
box. So
Yes.
Soumya wants to ask, what signs should I look out for that indicate my mind is starting to manage me instead of the other way around?
Huh? Right. Wonderful question. Soumya. Can I see Soumya? Okay, I would like to see you, Soumya, if you are in the meeting.
Yeah, she's here.
Yeah, great. So the signs when we say the mind is managing, most of the time it is related to the emotional part of it. When we start making emotionally driven decisions, when we start reacting to the situations more than responding to them, when we start overthinking, it's a very common concept, right? When we start overthinking about certain life situations, when we see changes in our behaviors, when we see changes, negative changes in our productivity, and something that we start referring to as not myself. When you start seeing yourself that you are out of place, you do not feel like you belong to yourself anymore. That could be your sign where your mind is sort of managing. You know? Managing as in this is the negative part, the negative emotion. You know, your sensitivity is more, the negative reactions are more. These could be your signs where you can say your mind has started managing you more than the other way. So I hope I have answered your question. And I think I have opened doors for new questions having said all of this, right?
Actually, it's true, Devika, because I got another question from a
Uh-huh.
champion. So it's the
Uh-huh.
question from Nitya. So Nitya
Uh-huh.
wants to ask, how do we overcome our regrets?
How do we overcome our regret?
Regrets.
Okay. Wonderful question. First, let's talk about nature of this regret. Now we have different emotions. Again, I will come back to the emotions part. Uh, so we have a few emotions which are we can consider it as normal. Okay, happy, angry, sad, easily identifiable emotions. There are deeper level emotions which can be grief, regret, guilt, shame. These are the deeper level of emotions. Why are they deeper? Because they have a long lasting impact over our minds. Okay? Anger, happiness, sadness can keep coming and going easily now and then. But these emotions, mostly negatively, they impact our lives for a longer period. Now, to overcome something as deep as that, first you have to give yourself time. Along with this time, it's also important that how you use that time for your healing. Regret also requires healing because regret easily pushes us to self doubt or hating ourselves for making a few decisions or something. Okay? When we try to overcome our regrets or any guilty part of ourselves, it's very important to connect back to that version of ourselves who made that decision. We evolve every day. We are not the same. Today I'm different, tomorrow I'm going to be slightly different. Today, whatever questions I'm getting from you, the answers I'm giving you, it is going to add up to my insights as well as it is adding to yours, right? So when this version changes over the period of time, it could be 10 days, it could be 1 week, it could be a few years also. It depends. The intensity of this regret will depend on how many days have passed in. But we need to get in touch with that version of ourselves who made a particular decision, and the future version, or like let's say the current version now, is regretting that particular decision. As a child, maybe we take up something, some sport or something, and we fail in that, or something happens, we get an injury, let's say, we have to carry that injury throughout. We have to always mention to the doctors, any medical exams and everything. Yeah, I have this injury, I have this injury. You cannot, this might create the regret. Why I had to go there and do all of. So now, as a child, you had limited knowledge. Similarly, even as we grow up, we have limited knowledge sometimes. We do not know what we are doing, or we do not know enough to make a decision maybe at that. So, forgiving ourselves, accepting where we have come from, and appreciating our journey so far. Regret, if it's actually a bad decision for yourself, regretting that is a milestone for you, because it sets you up for improvisation. It sets you up for rectifying and making yourself better. Okay? So this could be your mindset when you try to overcome regrets and guilt. And obviously, like I said, through therapy or through counseling, you can always go for a customized answer that you're looking for if it's coming from a personal experience. Nitya, right? I hope I answered your question, Nitya.
Yes, ma'am. Thank you so much.
Perfect. I think we have another question. Oh,
Actually, I do have one question. So, as you have mentioned about the Inside Out movie, right? So, I did
right.
watch both the parts, first and second as well. In the second
Okay.
one, there was one
Uh-huh.
character called Anxiety, and it was
Uh-huh.
somehow very much relatable for me because its acting and everything was so much relatable. So, I
Correct.
have one question that is stress and anxiety are two different emotions, or is it like stress is an impact of being anxious?
Right. So stress and anxiety is a very commonly used terms, and they are very like there's a very thin line between differentiating stress and anxiety. Sometimes even as you feel it, you say that I'm having anxiety, and as you present it, as you share with the other person, you will say, "God, stress, I'm very stressed today." So it's very difficult. The slight difference is in the sources of stress and anxiety. So stress is more, the source is more extrinsic. You come across a situation, you are encountered with something, and that gives you stress. So that generates stress. Anxiety is more of intrinsic. Okay, it can be an impact of stressful situation. Anxiety, but anxiety is developed. Let's say anxiety is basically simple definition of anxiety is piling of the thoughts one by one and never leaving your subconscious. These thoughts just stay there like unwanted guests and they never. That is anxiety for you, to understand it in a very simple term. So that's the difference. And symptoms, if you ask me, stress gives you more, like I said, behavioral symptoms. You will see behavioral symptoms when it comes to stress. And anxiety is more in your mind, overthinking, like I said. Getting panic attacks could be a part of anxiety, extreme severe level of anxiety. So this is the basic. The sources are different for stress.
Thank you, Devika. There is one more question from my side. I know
Uh-huh,
whenever you conduct some counseling or some sessions, it is not allowed, like you are not allowed to share that experience, right? But if
uh-huh.
there is any personal experience from your side where there are some, breathing techniques or some panic attacks were happening to that particular person, and due to some different techniques, there was significantly improvement in the mental health. So, will you able to share something about that?
Yeah, definitely. So we can definitely share cases as well, not just, we can just filter out the names and demographics. So yeah, a few breathing techniques can definitely help with anxiety. I was just coming to that. Stress and anxiety, we talked about the nature and all, but how to manage. So a breathing technique, which I usually suggest to people, is the technique called 4-7. We can try that even now in the session. Those for those whoever it's possible to switch on the videos. Please go for it. I would like to see you all doing. So when we say a breathing technique, it's not just a breathing technique. I have a small modification from my. It's a visualizing technique. Okay? Many times when we are stressed or when we are into a tense situation, when we feel anxious, there is a lot of anxiety, lot of thoughts coming in, all at once. We need to reconnect to ourselves. Okay? For that, we need to first release it from the system. Okay? So this technique called 478 is a structured technique. In therapy sessions, it's guided from the therapist side. Okay? So what we do here is that it's a breathing technique plus a visualization technique. So if you just close your eyes and visualize that there is a vacuum cleaner, sort of a machine like a small vacuum cleaner, which we are going to insert in our minds through the breaths that we take. Okay? So first 4 seconds are for that insertion of that vacuum cleaner. Next 7 seconds, we give that vacuum cleaner to collect all the negative thoughts which are just, coming in and falling in. And in the next 8 seconds, we are going to throw them out of the system, out of the body with the 8. Okay? Can we start doing that? If everyone is ready, it will be guided. Just close your eyes. Imagine in the next 4 sessions that where you breathe in, that this vacuum cleaner is being inserted in. 7 seconds to collect the thoughts, 8 seconds to throw them out of the body. Okay, let's start. Shoulders at the back, chin up. Okay, yes. As I count, start inhaling. Okay, 1, 2, 3, 4. Hold for 7 seconds. 1, 2, 3, 4, 5, 6, 7. Release it. 1, 2, 3, 4, 5, 6, 7. I'm sure in the first go, maybe you were not able to think of a negative thought as such now, right now, because we are into a discussion mode. But when you are into a situation where you're anxious or you're tense, there are not just one, many thoughts, just crowding your mind like anything. And at that point of time, this visualization technique, if you rehearse for once, twice, thrice, how much ever you need, back to back, it is definitely help to calm your nervous system down. Okay? It's going to help uh, clear your channels of thoughts and help you think clearly, help you emote better, help you to explain to the other person what is happening to you so that you can ask for help as well. So that was a breathing technique which can definitely help.
Thank you, Devika. Aishwarya, you raised your hand. Would you like to add something?
Yeah.
Yes, Devika. So, thank you so much for this exercise. I think we all need it. At least we champions need it. Now that it is the time to submit the proposal.
Yeah,
Uh,
yeah.
so yes. And just one thing, like recently we were having a discussion regarding, how we don't give our bodies or ourselves enough time to heal. So like, let's just say that we have been like for a year or, maybe more than that, we have been in a very, I don't know, in a bad place. And we were not mentally okay. And then when we come back from it, it's okay. Like we realize that that bad period is over, but then we don't we immediately get ourselves into something new, some other work. So we don't give ourselves this time. But then like I was like yesterday I read an article and I was contemplating on that. I realized that if we give enough time and if we take a break, do nothing, the mind is gonna create more chaos for us. It is like it is gonna throw in thousand questions that why are you relaxing, why are you not doing this, and it is just going to add to the cause. And if we don't relax, if we just go on directly to some other work and we start pursuing that, then the problem is that we can't 100% devote ourselves to it. The body feels that burnout.
Right. Perfect. Burnout. That was something I was looking for. The word I was looking for. So your question is how to deal with that, right?
Yes, I mean, what to do? Like, should we take a rest or should we work or how to deal with it? Because either way, we have to devote ourselves 100% when we are working at least. So
Yeah,
that becomes an issue.
definitely. And this burnout, Aishwarya, is not just physical, if you see. Okay? When you're working on a project or your assignments, I do not exactly know the nature of your work right now, but let's say researches or connecting to people, coordination, so many networks are getting created in your mind, the neural networks. They take up a lot of energy. They create somewhat stress to your mind. Okay? Sometimes the condition which you mentioned happens because this subconscious mind, again back to that, is getting comfortable to this situation. It's not ready to leave this situation. The more you have to walk on eggshells, it's more excited and wants to do it even because it's rehearsed to the similar pattern. So it's difficult for you to rest, or it's difficult for you to not have something to do immediately in front of you as a task or as a okay. But like you rightly said, it does create a physical burnout and also an emotional burnout. Okay. These neural networks which are created, it is the stress goes up to the cells of the body. Okay. Practically, when I say you feel, all this pain sometimes in your head, sometimes in the back and everything, it does go up to the cells of the body. Okay. So we need to physically rest, definitely. But how to, feel okay with resting? I think that was your question. Not constantly being. Most of the times when you are constantly you have that compulsion to work on something. That is because you cannot be comfortable in your own. You are not comfortable in your own company. Okay? Your body, your mind compels you or pushes you to work more, to engage with more people, to coordinate with other people, to have something, some working on some task because it cannot sit with your own, thoughts or emotions or just yourself. That does not happen. Your self-esteem in such cases is associated with the work you do, just your professional self. If we are just talking about the profession part, if you're doing something else, it's about that. So we have different domains in our life. It's not just work, it's not just study. You must have read these, lines when these UPSC exams are coming in. Any competitive exam season, you will see written, in many Instagram posts. This exam does not define you. Your marks do not define you. It's actually true. You know, it's not needed. It's not necessary to completely associate your definition of self with what you're doing, what work you're doing. Okay? So it's equally important for you to take breaks. It's equally important for you to give time to what you are practically like. The definition of self-care and self-love these days has become pampering yourself, eating junk and everything. But I think the purest form of self-help could be just sitting with, doing whatever you like, sitting with a book, spending a nice evening, having a cup of fresh chai, coffee with your mother, gossip a little, read your favorite book, watch an episode or two of your favorite series, write something, journal, attend a therapy session, anything of that, something that you do. Okay? And it actually boosts your productivity more. You are ready, your mind, body is fresh and ready for the new work which you are going to do. Okay? So do not try to push yourself away. The real you, the genuine child, the inner child in you wants to come up in these breaks. So let's not stop it. Okay? Let's not associate ourselves entirely with the work we are doing.
Thank you so much. That was such a detailed and, well, well dictated answer. Like, thank you. I'll try to apply that.
Great. I would love to hear your feedback after.
Devika,
Anybody?
continuation
Yeah.
to your explanation. Okay, so what you have just said, right? Ki do something that you want to do or what makes you happy. But sometimes it happens that you are like, I don't know if is that is subconscious or conscious mind. I'm not sure about that. But somebody is telling you inside your brain, like, get up, you have to do this. It will relax you, it will calm you, something like that. But somewhere your body or your another mind is not in the state of working or doing that thing. So in such a case, what should we do? Like we know that, for example, I love drawing, okay? And I know if I'm stressed out, if I draw something, if I just color a picture, then it will calm my, like it will be calming for me. But there is one situation where I just don't want to get up from my bed or just want to sit and binge watch the web series. But binge watching is affecting my eyes in a different sense. So in such
Yeah,
a case,
yeah.
what should we do?
So it is, if it is just about, channelizing your energy in better ways, being creative, getting in touch with your creative side, not about work, right? This is what you're not talking about work part.
Yeah,
Because
no,
if it's
not
work,
work.
it's compulsory. You have to get up, and in that case, we can call it procrastination, the term you explained. But if it is just about the creative side of it, and you are still sticking back to your binge watching particular series, uh, somewhere definitely you have to push yourself, somewhere you have to begin. But more than that, start asking yourself the questions of why and why not. Okay? Why do I want to stick back to my laptop and watch this series? And why can I not go and just draw one single picture for next 15 minutes? Okay?
Can I just
Maybe,
answer that as well?
yeah, yeah,
My
please.
mind
I
is
think you
like,
have,
yeah, I have the
yeah,
answer ready. So my mind
yeah,
is
yeah.
like, when you are binge watching, you just don't have to do anything. You just have to sit. That's it.
Uh-huh.
Even if you are lying and just keeping your laptop in front of you, that is also fine. But when
Right,
you have to draw or sketch or paint, there is some movement involved. There is some mind that will be working. Like this color will be suited in that particular area. Like that something is working. Maybe that is the
right,
reason why mind goes to binge watching and not to the drawing.
right, right. So the ready-made entertainment is something which
Yeah.
difficult for all of us to live in somewhat areas, right? And in such cases, if your mind is practically denying the job, denying the task, creating that environment to paint or draw, maybe start from something very less. Okay. You know that you want to get in touch with your creative side. You know why you want to do that. And you know that whatever you are doing is not healthy for any of your body parts, let's say. Okay. So your goal is clear, your priorities are clear. Now, to take up an action, keep lying in the same position where you are. A day before, wherever you sit and you have your laptop, this is a very behavioral activation we are talking about, nothing related to mind thoughts or anything. Okay?
Yeah.
Just have a small notepad and a marker maybe ready there. Okay, whichever color you like. Okay, just shut your laptop, use it as the pad, the writing pad, the support you require for that. Keep your notepad there and start doodling. Okay, start drawing what you can draw on a bigger canvas. Let's start with a pilot project for that. Okay, so that is something you can start with like a baby step. When you practically see that for a while, maybe if you have a lot of gathered a lot of courage to take this step, maybe this step in itself is going to take a lot of time. Let go 15 days in the same. Next, after 15 days, you will get bored of this. Then you can practically set up a canvas a day before. Okay, that tomorrow I will do. So maybe that way, planning that goal in that way might help you. Okay? Start from a small movement. When entire workout is not possible, I say this to a lot of clients for exercise and all. When entire movement is not possible, start with just moving your eyes, moving your neck a little, something which you can do sitting in one position. Yeah, think that can help.
Yes, definitely. I'll try doodling at least.
I will
Uh,
wait for your feedback.
yeah, definitely.
Yeah.
Continuation question for this situation
Yes.
only. So
Uh-huh.
let's just assume there is something in my mind that I want to work on. Okay, not related to work exactly, but there is something I want to work on, like let's say painting or let's say binge watching as well. But there is something in my mind that is stopping me from doing this. So is it a sign of something like my anxiety is kicking in, or is there any different emotion which is affecting me, and that is why I am behaving like that? If so, how can we identify which emotion is overpowering us and that is leading to some another impact or something?
Right. So what I heard is there is some pending task or work, something that is in front of you, something looks like a priority. you are planning to work on it, you have the interest, but somewhere the motivation is not there. It's difficult for you to practically, take an action on that. Something is restricting your movement around, right? So you want to know why this happens and how do we identify why it's happening, right? So in such cases, like I said, again, it traces back to the aspects of yourself. Somewhere, if you are lacking the confidence, somewhere if you're lacking the self-esteem, in any cases, if you feel that no, I am not ready for this task is not ready for me. I am not the right person to do this. I am not the right person who deserves working on this. If these are some thoughts in your mind, or there is something externally in the resources, maybe in the team, your dynamics are not good with somebody, you're not comfortable in this situation, you're not comfortable doing that work, it is not in your interest, it is not in your area of expertise. You need to upskill yourself for that. So maybe taking a step for all of this, you do not find yourself worth for all of that. So in such cases, you can definitely consider talking to a therapist about it, to increase your self-esteem sometimes. And if it is just, something that looks like laziness, like I said, it could be procrastination. When you have all of these filters and everything set, but you just cannot, move a finger around it. I do not want to. If you're just pushing your task forward, again, a therapy session might help you.
So, what are the signs that I should look for where I need to seek for a professional help for my mental health issues? So, is there any particular set of signs or some behaviors or some extreme thoughts like there is nothing I can do, so I'll just quit everything? Like that is the end point, or that will be the starting point that I should go for a professional treatment or something?
Right. To be very honest, there is no start or end point for this. Any which ways, like therapists also have their personal therapist to go for, because at any point of time, sometimes just to vent out, just having a safe, non-judgmental space can help. Many of my clients, when they come for the sessions, most of the times, they keep on talking and sharing with me, and just my active listening derives them, on their own, they will navigate to the solution, and I just put some structure around. Bas, that's it. Okay. So sometimes even at such cases, therapy can be considered. Otherwise, if you say uh, signs that you can look for and which can say that your mental health needs some attention, could be burnout, like Aishwarya said, emotional or physical burnout, uh, changes in your productivity, changes in your mood, and like sustainable changes, where you can see it's been 2 months, 3 months that you have been in a similar mindset. You have a lot of fluctuations in your mood. Sometimes, most of the times, it's uncontrollable crying. You do not know what you're crying for. Being stressful, agitated, irritated all the time, or your reactions have changed. You get similar feedbacks from the people close to you. People will say, "Itna kyun chidki ho?" Why are you so angry all the time? Chill, no, we'll figure out. If that is coming from a lot of close ones for a lot of time, longer than 1 month, then definitely you can seek a help of a professional.
Wow, that was very helpful for me because honestly speaking, like there are some friends who are very close to me and they just keep coming to me with their problems, and every time I am like, yes, I have the solution, but when the problem comes to me, like the problem is from my side and I have some something to share with somebody, I need some help from anybody, it's like I'm unable to share my problems as well. So that is
Right.
why I asked you.
Right. Many a times in what case you just shared, if you have been experiencing this, that many people come to me for help. You yourself put yourself in an authoritative position or a leadership position, and it's very difficult for you to step down. And when you feel that you have to present your vulnerable side to somebody, it's practically not possible to you now after these experiences. Okay?
True.
But again, a very important point, which I wanted to cover today as we talk about the mind. And I think even a few things, I think Santosh asked the question about decision making. There is an aspect of self which I have been highlighting: self esteem, confidence, and all the aspects of self, how we look at ourselves, and everything, even with the burnout question of Aishwarya. So, there are three aspects of self as well which we need to consider when we are talking about the mind, thought, emotion, and will. Okay? So, these three aspects of mind, self, are ideal self, social self, and real self. When there is a huge discrepancy between these cells, we usually find ourselves always in a question mark, not able to make a decision, not able to be very assertive, not able to be very affirmative about things, not able to set boundaries, not able to convey or share, how we think about stuff. Okay? So when we say ideal self, maybe the examples will help you a little to understand. Ideal self is something where we want to reach. We keep pretending, sometimes very subconsciously these things happen, nothing right or wrong, but these things are ideal. That's the ideal version of ourselves. We keep on, it's like faking it until you make it, that kind of attitude we have. So if I'm saying, no, I'm a health conscious person, I'm on diets all the time, I am a person who works out all the time, when I'm out with friends, that I won't have a cheeseburger easily. But when I'm at home, I'll just grab two cheeseburgers just like that without thinking. Because that is something I consider as to be ideal. I want to be that person. So I'm pretending to be that. Then comes in the social thing. Our image of self is built as a child as we grow up. There are many people who give us feedback. First there are parents, then there are peers, then there are other people. So they will keep on telling us, you are good in sports, you should go for sports. They will see you in some competition. You have a very competitive spirit, go for it. Practically, you are a person who enjoys music. There is always going to be that discrepancy which will confuse you. सब तो बोल रहे हैं I'm good in sports. Everybody is saying I'm good in sports and I'm a very sporty person, but I cannot handle competition. I don't want to. Okay, so that's the social image that we create of ourselves because of the feedbacks and because of the projections other people have for us. And then there is a real self, a mirror reflection, which we exactly know. I know I'm a person who cannot, resist a cheeseburger. I know I'm the person who is inclined towards arts and not sports, even though I'm good at it. So that's the real self. Now, when there is a, like I said, it's okay to have these three selves, considered while we make a decision or while we make an image out of ourselves. But it's very important to understand the discrepancy between all these three. Okay? When there is a lot of discrepancy, we have a lot of confusion about what we want, about what our needs and priorities are, about our goals, about our resilience, about our consistency regarding. So that is one point I wanted to cover today as we speak about mind.
Wow, that was so much to take in, but everything was so relatable that, where to start and where to stop. That is kind of a situation for me right now. If anybody have any question, they can just unmute themselves or they can just, type in a chat box.
Not a
I
question,
think
Shavani,
Santosh
but
has.
I just
Yeah, go ahead, Aishwarya.
yeah, just want to add here, like as she was telling us about these three selves, right? I could actually find myself giving examples of, how
Yeah,
I do this, how I do that,
same.
and how I'm
I was
stuck here.
thinking same. It was very
Yeah,
relatable. That is why I mentioned that only.
And I
all
think,
of these
while
things.
making decisions, this will help. This
Hello.
will actually help us because we'll understand that, maybe this is not our real self. This is the perceived one and this is the ideal one.
Yeah.
Thank you.
Hello.
Yes, Shantanu, go
Yeah,
ahead.
Shantanu, yeah.
So what
Hi,
I'm
Shantanu.
was thinking to, like, if kindly share something about how to control emotion, and you know like sometime, I mean, I know this is like beyond some expectation, or I'm expecting little I mean, more than something. So, I mean, how to control that sort of emotion, like, so that I can help other person that, for being disappointed or something.
Right. Right. So,
So, or
as I
otherwise,
said,
like, I put the question in this way, like, see, our
you can
relationship
give me an
mostly,
example. Yeah.
I mean, our relationship mostly depend on, or I mean, we are moving forward with certain expectation, like it may be over expectation, or I mean, so sometimes it not being feel, we understand, but and then controlling emotion is very difficult. Like it's not met the expectation. That's what I mean to say. So in that sort of situation, how would I, balance the whole context or being happy on those moments also?
Okay. Okay. Understood. Your question, the answer to your question is multimodal. It is going to come from different channels. I'll try to explain you whatever sub questions you have for me. I'm ready for them. Okay. So when we talk about controlling the emotions, again, control is not the word we are looking for. We are looking for channelizing the emotion. Okay. So it's where you are going to take these emotions. Having those emotions, it's okay. Now accepting them, again, okay. Where you want to take them, what sort of channel you are giving to them is very important. In a relationship, I think what you meant is sometimes there is an expectation, it is not met, you are disappointed, and you usually project it to the other person. That I had this expectation, you disappointed me, and now I am angry or something like that. In this case, in terms of understanding what we say, it's very important to empathize with the other person. Okay? Firstly, when you have an expectation, it is only about what you feel. Even though it is about the relationship, about the other person, it is still just your perception about it. You need to involve the other person. You need to verbally communicate the expectation you have for them towards your relationship. When once that is communicated and still it is not delivered, sometimes we are not perfect. No, we are humans. We are allowed to make errors and we usually disappoint other people around. The close ones will always be having more expectations from you and will be getting disappointed even according. Now, when you are disappointed in the other person. Empathy is a very, very effective tool which you can use. Okay? Empathy, very easy. Putting yourself in the other person's shoes and imagining the scenario from their perspective. When you do that, if that's the personality I am, what would I be reacting? You understand the other person's defenses, you understand the other person's genuinity, understand the other person's situation, you understand the other person's past experiences, so many factors to it. Basically, it eases you out into the situation, helps you accept it better, and again help you to take an action over it. Communicating the whatever issue it is and sorting it out, settling down with it. Maybe you will require an action plan after that, setting a boundary. Making sure this does not get repeated. If it does, what are your takeaways? What are your pathways to go with something? Okay. So, Shantanu, I hope I have answered at least some percentage of your question.
Yes, yeah.
Right? Wonderful. Anything that you want to ask more regarding the same thing, because the question had multiple channels to it. Yeah.
I mean, sometimes what happens is, in social life, I mean, apart from sort of individual perspective, like we each one of us have some perspective and what we are living, like we are
Your
running our
voice is
lives.
not clear actually.
Yeah, just a minute. Shantanu, can you just try
I just
turning off your camera because you are not audible?
Is it better now? Is it better now?
Yes, it is
Yes.
better now.
Is it better now?
Yes,
Yeah.
yes.
Yeah, ma'am. So the point what I'm trying to mean is like each one of us have some individual perspective, and because of that only we are living our life or leading our lives. But when it comes to a social dimension or living in a society, living with sister, parents, and so-called neighbors or anybody else in that context, So what happens is there are certain sort of, set expectation that if you will do this, they will do that. But even though there's this certain norms, you get my point. Like in certain festival, you have to give, and they also have to give. And for some sort of clothes, for example, a very petty sort of thing.
Yeah.
So even like taking a decision, okay, this time I'll not give. It's very difficult.
Right.
And that also, for example, like it's like we are not able to fulfill the expectation, and that's what like it leads to the multiple challenges, like you said, not able to control the emotion, we freak out or they freak out. So those things are very challenging for me sometimes, like I feel in that way. So that's what I put the question. And your class was amazing, due to certain reason I'm not able to some guest came to my house, so I just thought I not switch on my this thing. But that's what I mean. That's my question is that only. I mean, that's what that leads me this question to this.
Right. I know. There are some obligations sometimes, and we need to negotiate a lot when it comes to living with people in society, because as humans we are blessed with a lot of emotions and thoughts, perspectives, different perspectives towards one same situation. You'll get 100 perspectives to it, meeting expectations and everything. But we do have magic, which is reaching to the midpoint of it. We can always negotiate first with ourselves and then with others. Best answer when it comes to interpersonal relationships and the dynamics we share with other people is that if you have clear dynamics with yourself, if you have a clear connection and relationship with yourself, if you have good awareness about yourself, that genuinity is going to reflect in your interpersonal relationship. If you are true to yourself, you are going to be true to other people. If you love yourself enough, care for yourself enough, you are going to be the same person for others. If you are able to understand your needs and prioritize them, you are going to be a person who provides very well, contributes very well emotionally or any other factors to the relationship. Okay? So that's the basic of it. And for I think Shantanu, if you are struggling with something when it's related to the interpersonal issues, you can definitely consider therapy or a few sessions of counseling. Yeah, I think.
Thank you so much. Thank you so much.
Yeah. Yeah. Kanchan has a question.
Hi, am I audible?
Yes.
Yeah, you are. Hi.
Hi, Devika.
Hi.
So, my question is, when we go through some events and they are a little traumatizing to us, and then we figure out the trigger points, that these are the trigger points that are affecting us. It's been quite some time, but still those trigger points are again and again, they're pinching. And whenever I am in such kind of a situation again, they reappear, they resurface.
Yeah.
So what should we do to recover from that particular thing? And how do I recognize that this is my trigger point and I should be working on it this way? So is there any particular way to tackle to them?
Definitely, yes. So if it's a really traumatic condition for you, and like you said, if many years have passed and still you are not able to, like anybody is not able to move out of the same mindset as it was during the traumatic situation, definitely considering therapy is a must. Like there is no substitute to that, because the steps for releasing this trauma out of the body and the system is requires guidance of an expert. Okay? Because when you are processing the trauma, the answer is processing this trauma and releasing it. Okay? When you are processing this trauma, you need some support, emotionally, some validation as well. Okay? And that can happen through therapy. Your therapist is not going to always validate you, but it's definitely can help you to find a track for yourself when it comes to trauma. Okay? Now, coming back to a very methodical answer for especially dealing with trauma. Trauma, the feelings we have from trauma, okay, or the triggers that we face, and those triggers are generating same kind of emotions to you, we need to work on the intensity of that emotions first. Okay? For example, a very common example when it comes to trauma, when we are into a similar place, okay, geographical place, I mean, very easily we have the flashbacks of that incident, the traumatic incidents, and we usually cry out. It only shows that there are a lot of unhealed emotions suppressed inside. Okay? You know what has happened, but just the knowledge of it does not work sometimes. Sometimes you usually, distract yourself from these triggers. Okay? Avoiding certain places, avoiding certain people, avoiding certain type of clothes. This could be these could be some. To deal with trauma, systematic desensitization is the method that we go with. Okay? Because we cannot change the mindset overnight. We cannot erase, go back and erase what has happened. That is not humanly possible. So what we do is, whatever the association we have with that particular traumatic incident, we try to disassociate from that particular incident. Like, okay? And it has to happen systematically. We cannot jump into the traumatic, incidents, talk about it more and more. But that does happen in catharsis, where we slowly unfold what was the incident, how it made you feel, what was your mindset at that time, how have you changed now, because trauma does change, right? For the good or the negative part. But we systematically go for it. And that happens in a therapy. When you talk about identifying these triggers, okay, like I said previously, when a particular situation or any character, any aspect, is triggering your emotion and it is long lasting, it's not easily in your control. It's very difficult for you to, mix up again with the same emotion, mix up again with people. Then it's a sign for you that trauma is still hitting you and it needs to be taken care of. Okay? You're not completely okay. It has a long lasting impact. That geographical place or any sort of stimulus, any sort of, it could be an object, a person, the way a person speaks, something like that. I hope that answers your question, Kanchana.
Yes, mostly. I have another question related to this aspect only. So it is personal to me, and I'm sharing this thing that so I am unable to make a decision about my career choices because of somewhat relating to that trauma. So do you think that it is important for me to take a therapy to reach out to that way, or is there any other methodology that I can follow to, on my own to reach to that decision? Because I am juggling between two different choices or maybe three different choices, and I'm not able to make a decision which way to go, which career choice should I take, right? And that is because of that trauma response or that something which is triggering me. When I go one path, that triggers me, and then I believe that this is not for me. I should go the other path. Then when I take the other one, there's something which is in my head which allows me to think that this is not the right path, you should go to something else. Then I jump onto something else. Right? This is just an example of putting it in this way. So if you can guide me on that.
Definitely. Kanchan, first of all, as a therapist, I'm really proud of you for identifying something, having the willingness to work on it and talk about it. Okay? Give yourself a pat on the back for doing that, because that's a very, very important step. Okay? Because when we talk about trauma, there are 4 steps, and out of that, first step is a step. Okay? So, now to answer your question, if trauma is holding you back in taking your steps further towards your career or whatever goals you have, prioritizing what your needs are, okay, and planning your goal according to that could be 2 steps which you can do. Okay? If you have already worked over it a lot, gave it a thought not once but multiple times, uh, you know, have tried a few things but still feel feel like it is not suitable for you or it's just not happening, you are not able to resonate with any choice which you make. If this is the condition which you feel that you are stuck into, the best way is to go for a few therapy sessions if you know that trauma is the reason for it. Okay? Because it's just an obstacle there. If you have analyzed yourself so much, and if you know so many things about yourself, there is a need to release the trauma in this case, especially to release this trauma, to unlearn the unhealthy things that are coming out of it, and to learn some healthy ways to cope around. Okay, and further into goal setting and making that choices, you can do that for yourself. Basically, whatever efforts you have taken so far, if you have done that, putting a structure around it, unfolding it in systematic ways is something which you need and which will happen healthy. Okay,
Thank you, Devika.
thank you.
Guys, anybody have any question? Okay, so there is one last question from my side.
Yeah, yeah,
So looking at the time, we don't have that much time. I know that this discussion can go on and on and on, but we have some time restrictions. So
yeah.
let's just have this last question. And if anybody has any questions, they can just revert back and we'll just share your questions with Devika. So my question is, looking at the variation of lifestyle, changes in eating habits or changes in general lifestyle, does these factors affect our mental health or influence our mental health in some sort of like social media is definitely impacting a lot of people in a sense of mental health. Apart from that, are there any aspects like not doing physical activities or just doing work on a day-to-day basis, not taking any break, or just change in eating habits? Does these kind of factors influence our mental health?
Definitely, definitely it does. You might have seen, a lot of blogs, newspaper articles regarding mental health and eating habits or mental health and exercise. Mental health, like I said, your mind, it's related to your mind, and your mind and body are always in the same, right? When you do not exercise, let's start from the point where you have mentioned. When there is no movement, your mind does not know how to process these emotions and the experiences. Okay? There are neurotransmitters, in the brain working for us. There are total 9 systems in the body working, helping us to move swiftly and living the life that we are living. Okay? Similarly, we have these neurotransmitters in our body. When you practically move, okay, sometimes you will have a good day. You watched a movie, you binge watched a series which you like. You had a great food. That one pizza you were waiting for, you had it. You spend time with your friends, and everything is perfect. Your outfit is perfect and all. But still, you do not feel like you have enjoyed your day. There is some sort of silver. It's not a silver line, but there's some sadness. There's a pinch of that. Just don't feel productive. Just don't feel good. Something like that. Or maybe even at work, you have achieved your target for today, but you do not feel good about it. And that becomes your pattern just because there is no mood. In the clients, especially clients who come with depressive symptoms, with anxiety, with grief, with trauma, I usually tell them to at least move for 15 minutes, go for a quick 15-minute walk in their vicinity. Because even 15 minutes of a movement generates happy hormones. There are different types of happy hormones, endorphins, which are generated through movement. You naturally feel happy. Even if you don't want to, you feel happy because they generate that hormones inside. There is dopamine, serotonin, and all of these, what we can say, happy hormones are associated to different forms of happiness. For example, endorphins after an exercise will make you feel refreshed. Even after a gym, you feel fresh because that workout was so good. That's how we say, you will hear gym buds saying this. Yeah, workout hua hai aaj bhai, that kind of a thing. Because you feel happy, not just because you have achieved that 50 kg or 100 kg ka dumbbell. Okay? So it makes you feel refreshed. With different other activities, even if you paint, I think Shavni, this is for you. Even if you paint, there is a quick dopamine release. If you go for a trek, there are other chemicals generated in your brain, which naturally make you feel motivated. They make you feel supported in some way. They give you a sense of satisfaction, content, all of this. These are different forms of happiness. It's not just joy and celebration. These are different forms of happiness which we usually want to experience on daily basis. Right? So that's how exercise helps you. And otherwise, with food also. Now, coming to the eating habits, another very important point when it comes to mind and mental. Stress is something we all have been talking about, right? So this stress, usually, it's a vicious cycle. Stress heightens your cortisol levels, and cortisol levels again reproduce stress body. When you experience, a lot of craving for some salty food, junk food, cheesy food, or you want to go for more sweet, that's you trying to validate your cravings or satisfy your cravings coming out of cortisol. Okay? So it in turn is increasing more stress. Okay? So try to have green vegetables. It's a very boring advice, I know, but try to have at least healthy meals for 5 days a week. Saturday, Sunday, we can use ourselves a bit. Right? So eat more of B12 uh, vegetables or food items which give you all of these different nutrients you require for your physical and your mental health. Almonds for the memory, dates, seeds, all of that. Do not skip that.
Thank you so much, Devika. We'll try to incorporate at least that green vegetable part, wala part I'm not
Yeah,
sure of. But
yeah,
maybe other things definitely we'll try to incorporate.
yeah.
And thank you
Sure.
so much for your time and taking up such a interesting and interactive session. So there is one ritual at our OMLAS platform. Everybody here knows that. So at the
Uh-huh.
end of the session, we take a screenshot of everybody with the
Wonderful.
smiling face.
Yes,
So
let's do
let's
that.
just end our session with a cute
Definitely.
smile on everybody's face. So I would like to request everyone to turn on their cameras, please. Thank you, Pooja. Shantanu, Yogeshwari, I can't see you guys. Okay, there. 1, 2, 3, smile. Yes. Thank you so much, everyone, for joining today.
Wonderful.
If you have any queries, just reach out to your fellows or else just send a message to me. That's fine with me. I'll just share that with Devika and she'll just revert you back. Okay, thank you,
Thank you,
everyone.
Shavni,
Thank you
for
very much.
this opportunity. Thank you for calling me here, and it was a wonderful interaction. And yes, whatever questions you have, I'm right here. And also, Shavni will give my email ID to you all if needed.
Yes,
If
definitely.
anybody is looking for therapy, counseling, any sort of guidance, I'm right here. Not hesitate to reach out. Okay, it's not a sign of weakness. It will empower you. Okay? Take care of your mental health and all the best, everyone, for all your assignments and projects.
Thank you,
Thank you
Devika.
so much.
Thank
Thank you,
you.
ma'am.
Thanks, everyone.
Thank you. Bye bye.
Bye bye.